This segment is sponsored by GBMC Healthcare.
Total knee replacement surgery used to require some patients to stay in hospital beds for weeks. Well, joining us now to talk about how outpatient total knee replacement surgery has changed all of that is Chief of the Division of Orthopaedics and Director of the Joint Replacement Center at GBMC, Dr. M Schmidt. Okay, welcome to Be More Lifestyle. So talk to us about outpatient knee replacement surgery.
Sure. Good morning. So as you alluded to, years ago, knee replacement surgery involved a 4 to 5 day hospital stay. But over the years, what we've learned is that as we've made continued technical improvements, that we were able to do this as an outpatient procedure safely. So starting about 4 years ago, I began to do knee replacements where patients would go home immediately after the surgery. And particularly during COVID, we've had more and more patients who preferred not to spend the night in the hospital, not to be anywhere near the hospital. And so we've had more and more requests for doing the surgery on an outpatient basis.
So I'm sure that that would be of interest to any of our viewers, right, who have to have a knee replacement. How would someone know if they're a candidate for that kind of surgery?
So when patients come to the office, we do an evaluation. And if a patient wants to pursue outpatient knee replacement surgery, we make sure that they are in good general medical condition, and we want them to have a good support system at home. And if they qualify, then we proceed down the path of outpatient knee replacement.
So talk to us about the safety and some of the benefits of doing it outpatient.
Sure. The big benefit that all my patients say is that I don't have to spend the night in the hospital. I can sleep in my own bed. That's the big benefit for them. I think that when we do this, or what's allowed us to do this, is all of the advances we've made in pain management and technical advances, so that now, for example, when I do an outpatient surgery, they will come to our outpatient surgery center. We'll sit and talk. The anesthesiologist talks with them. We do a nerve block where we do an injection of a long-acting numbing medicine above the knee before we start. And this is meant to give patients 2 to 3 days worth of pain relief after surgery. Then I do the surgery. Before I finish, I inject the knee with a cocktail of medications so that when the patient wakes up after surgery, they don't have much pain. So they'll be in our little recovery room for maybe an hour. A physical therapist is right there on site. The therapist has them up and walking right after surgery, generally without the need for any pain relievers because of the nerve block and the cocktail. They'll even go up and down a flight of stairs. Their significant other comes, picks them up, takes them home, and usually they're home by noon eating lunch at home.
Amazing. What technological breakthroughs. Oh my gosh. Tell our viewers where they can go to find out more about what you're talking about and maybe get in touch with you.
So certainly the website, the gbmc.org website, they can go and look up my name and look up all the videos that speak to this. And certainly to come to the office, they call the office 443-849-3838, set up a time to come see us and talk.
All right, and we will also put this on our website too, foxbaltimore.com. Dr. Schmidt, thank you so much for being here.
My pleasure, thank you.